Could you be a part of the 85% of Americans that experience this pain right now? At any point in time, 6.8% of Americans experience this kind of pain. And you may ask, what kind of pain is this? It's back pains. Back pains are caused by multiple reasons, including spinal wear and even just muscle tissue and nerve damage. There are multiple solutions to back pain, such as back surgery. There's even pain medication like Advil, Tylenol, or even Motrin that could help temporarily fix the pain. But what is a more permanent solution? Chiropractic care. Jaton Bolin had the opportunity to sit with Dr. Patrick Zitt at Activise Chiropractic. Let's go see what they have to say.
Yeah, so this is Activise Chiropractic Clinic. My name is Dr. Patrick Zitt, and we are on Aaron Drive. It's 321 Aaron Drive, and we're right in the heart of Bearden. It's right off the paper mill exit, so it's a nice, convenient location. We do tremendous work with people, and that doesn't only have to do with the fact that I'm good at what I do, but that speaks to the power of chiropractic. It's amazing what your body is capable of when you just take the restrictions away, when you allow the nervous system to function the way that it's intended to. Then it's amazing what your body can do from a healing standpoint. I am here to get your body out of your own way and allow you to go through that healing process that you need to go through. And in my opinion, everybody on this planet needs chiropractic care. And this last weekend, I was in Atlanta at a seminar learning about why pregnant women and babies need chiropractic, and we watched birthing videos. The way that your head is twisted on the way out of that womb, let me tell you something, you need to get checked out. You can have subluxations, which are misalignments in your spine, from minute number 1 of your life, and you may not feel it right away, but that can start to cause you pain when you're in your mid-20s, early 30s, maybe 40s or 50s, and you're going, where did this pain come from? It might have started right from day one. So think about chiropractic for you, think about it for your children, think about it for your parents. It's for everyone, and it's a safe, effective way to get rid of those aches and pains that you have.
So what would you say the biggest benefits are?
Oh gosh, there are a lot of fantastic benefits to chiropractic care. And you're right, we as chiropractors, the profession hasn't done a great job of communicating what it is that we actually do to people, out in the population in our communities. So a lot of what we do in our office is educate. We talk to a lot of people about the importance of chiropractic care, and just to give you a little rundown of it, we affect the nervous system. That's the primary thing that we affect. And we do that by adjusting the spine primarily. The spine can get out of alignment in a lot of different ways. It doesn't take a hit from a huge football player or a car accident or something like that to cause this problem. It can be, you can sneeze and throw something out of alignment. It can come from we're not designed to sit all day long. So as a student, you have to spend time sitting for hours and hours, and you're down like this and you're writing and reading. You're craned over into a position that we're not designed to be in. So that repetitive stress can actually start to create restrictions and misalignments in the body, and it makes the nerves no longer do their job. It can start to compress and irritate nerves that come out from the vertebrae. And when a nerve is being compressed or irritated, all it takes is the weight of a dime sitting on a nerve to reduce its function by 60%. So it doesn't take a whole lot of pressure. My job is very simple. It is to find where the restrictions and irritations are to the nerves and to remove that irritation, and that allows your body to do what it's meant to do, which is heal itself. So this is a great place to start for a lot of different types of conditions. Most people come in with back pain or neck pain or headaches, but we do see other things like people will come in with issues with their bowels. They'll have irritable bowel syndrome or something like that. Now, is chiropractic the cure for irritable bowel syndrome? No. However, if they're having nerve compression and that nerve controls the stomach and the intestines, can that affect that? Absolutely. So we'll have people with low back pain, and after we start adjusting them, their constipation goes away. You know, they'll stop having diarrhea and things like that without any sort of medication, surgery, anything like that. And it's very safe. My malpractice insurance is only $2,000 a year. You know, a typical medical doctor, you're looking, you know, 20, 30,000 plus, all the way to anesthesiologists who are paying $250,000 a year for their malpractice insurance. I pay $2,000 for a reason, and that's because chiropractic's safe and they know that. So there's no reason to charge me a lot for my malpractice insurance.
Student like myself that has back pain, like talking to you now, I feel like it's more serious than I think it is, because I know students like myself, like we just take pain medicine just to numb it, like temporarily. Why is it so important for us to not like ignore the small signs and to actually take them serious?
Yeah, a lot of people ignore pain. You know, it's our nature to say, oh, it's going to go away on its own. You know, it's give it a week, let's give it a month, let's maybe give it a year, let's see, and people wait a long time to get things treated, and eventually pain is a strong enough motivator to get people in. But when you have pain, let's say that you have low back pain, if you don't get the appropriate treatment done, it changes everything that you do in terms of your motion. You're not going to sit down the same way. You're not going to go from sitting to standing the same way. You're not going to sleep the same way in your bed. You're not going to lift things the same way. And so that when you have one injury that you're not having treated, that's when things like hamstring strains start to happen. That's when you start to have pain in other areas. A lot of times people will go from having just low back pain to then they're having hip pain and knee pain and neck pain, and it's because it's all connected. So it's a cascade of events that happens one after the other, and it's like a domino effect. So by us treating that one problem, we're not only helping you just get rid of the pain, we're actually helping your body to support itself and keep you from having future injuries. And when people take pain medication only, if that's the only thing that you're doing to take care of your headaches, your neck pain, your back pain, that's like if your check engine light came on in your car and you just got a piece of duct tape out and just put it right over the check engine light. What have you actually done? You don't see the light anymore, so problem solved, right? But no, you haven't actually solved anything. You just covered up the alert system. Pain is just your body's way of saying, hey, right here, there's a problem. Do something about it. And most people ignore it for as long as they can, and then they come in here, you know, crawling in. And we accept crawl-in patients. I don't like that, you know, and they don't like that. You know, we want to get patients in before they're crawling in. And so that's why we always encourage people, don't ignore it. If your body's telling you something, listen to it and take the appropriate steps to get something done about it.
To your office for the first time.
Yeah.
Just tell me like what happens, like what steps do you take, what's the actual process of how you define the course of treatment and all the steps that follow that.
Yeah, it's really simple. The first thing that we do is something similar to what you're doing right now, is we sit down and we talk, and you tell me what's bothering you, what your daily life is like, the stresses on your body, what makes it feel better, what makes it feel worse. So I get some details from you first, and then based on what you tell me, that's what dictates what I do in my examination. So then we take you to the exam room. We will do an examination on any of the areas that are giving you trouble, and the examination consists of we measure your range of motion to see if your range of motion matches what it should be for your age and everything like that, and your condition. And we do orthopedic testing to basically we're trying to stress the areas that are causing the problem to see what it is that's actually the problem. We need to know, is it muscle? Is it tendon? Is it ligament? Is it the joint that's causing the problem? Is it the bone itself that's creating the issue? And the exam allows me to do that, and then that tells me exactly what I need to do from a treatment standpoint to get you better. And the worst thing that I hear people say when they're talking about chiropractic, or one of the things that aggravates me the most, is they say, well, you know, this feels more like a muscle condition. So this is, you know, only see my massage therapist, or this isn't something that you treat because this is muscle. I treat more muscular injuries probably than anything else. So we absolutely take care of the muscular injuries. And if the joints don't move right, that's when you start having muscle spasms, and that's when you get tightness of muscles and things of that nature. So the exam is about finding out why we need to do what we need to do, what the actual problem is. And then we go about after we do the examination process, we determine a course of treatment. So I'll look over any x-rays that I've taken and look over all the exam information, and then when it's all said and done, we actually start that treatment process together. And the treatment is usually pretty quick, and it's very painless. We adjust you anywhere that needs to be adjusted, do the appropriate muscle work, and then when we're done with that, we do rehabilitation, which we have Janelle do in our office.
Like, how long would you say that it takes the results to become evident?
It's a great question. It really depends on the case. And, we treat people from 1 week old to in their 90s, or even, we don't have any in their 100 plus range, but we treat somebody that's over 100 years old. And for little kids, it's usually a lot faster because the problems haven't had time to be there for long. When you're talking about an adult, somebody who has been going through the repetitive stresses of everyday life for such a long period of time, it might take, if the problem's been going on for years, it won't take me years to get you better, but it might take several weeks or possibly even several months to get you back to 100% of your function again.
What the difference between back surgery and actual chiropractic care?
Absolutely. Chiropractic is conservative. It's a conservative treatment. So there's no knives, there's no needles. This is the approach that we take in our office is a hands-on approach. So we are physically adjusting the spine, and it's gentle. You hear about chiropractors popping your back or cracking your back, and it sounds like a painful thing. It's really not. It's very gentle. We do the minimum that we can do to make a change to the body, because the less that we have to force your body to deal with, the easier it'll be for your body to take that change. When you talk about surgery, from the moment you have surgery, your body is never the same after that. The anatomy is then changed. So there are complications that go with surgeries. There's a reason why I mentioned anesthesiologists have such a huge malpractice cost per year, because there's a chance that you might not wake up from your anesthesia. Every time you get put under, there's a chance that you might not wake up. There's a chance that you could get a staph infection. There's the opportunity for a lot of different things to go wrong. And one of the things that people do when they have surgery, especially in their back, is they'll have surgery, they'll feel better, but then they don't make any other changes in their life. So what do you think happens? The problem happened for a reason. And they have all the same stresses on their life. So then 2, 3 years later, 5 years later, most people have to have a second surgery, sometimes a third, and they people jokingly say they call it back surgery because you're going to come back for more. And I hate to say that's the truth, but I do see that in our population. And that's not to say anything negative about surgery, because there are cases where it is absolutely necessary. But in my opinion, conservative treatment should be number one. Even before you take medication for back pain, you should get yourself adjusted at a chiropractic office. If you still need something to help to control the pain, that's when you look at medication. And then when those two things are not enough to control the symptoms, that's the only time that you're going to look at surgery. And we have had to send patients to surgery, but it's few and far between. There's actually stats out there that support that there is a 41% reduction in hospitalizations for people that have chiropractic care versus those that don't. There's a 30+% reduction in the amount of surgeries, back surgeries, for patients. And these are numbers that WebMD, if you're familiar with that, came out with. And Blue Cross Blue Shield actually just did a major study that shows that we are the #1 way to save money to get back pain treated and to have the greatest potential outcome after a 2-year time period.
for a college student that could possibly be experiencing like any sort of back pains, how do you think that this could affect like their overall performance, like as a student, and like affect their schoolwork?
Yeah, in a huge way. It will absolutely affect the performance that you have, because I mean, you know, if you have neck pain or burning pain between your shoulder blades or headaches, are you as focused when you have a day like that? I mean, none of us are. You know, when you're not feeling good, you're not sleeping well. You know, if you're not getting sleep, that's going to affect your performance. Chiropractic, one of the biggest things that people tell me when we start treating them is, I'm sleeping better. And so you sleep better, your body is allowed to heal overnight. And as you're going through the process and we continue to make changes to your body and you get better and better, you will certainly optimize your ability to perform academically as well as physically. You know, we work with a lot of student athletes as well. And so it has a huge effect on your body. And the things that I mentioned to you, the burning between the shoulders, neck pain, headaches, and low back pain, for my student population, that's what I see. Those are the things that affect most students, and it just has to do with the position that you have to be in for most of the day. And I can't take that stress away, but what I can do is change the way that your body is affected by that stress. Most interesting. There was a man that came in here who had horrible burning pain down his arm. Lost control of his hand entirely. Couldn't lift objects, couldn't write his name, you know, very shaky with every motion that he was going through. And he went to a surgeon who told him that he was going to have to go through neck surgery to repair a herniated disc. And after going through chiropractic care, we were able to conservatively treat him and do the proper rehabilitation, and we were actually able to save him from having to go through surgery. And at this point, he is 100% pain-free in his arm, has regained full motor function, so he can write his name normally, he can use his right hand, and he's a right-handed man. He can use his right hand as he did before. So it's pretty amazing how powerful chiropractic can be, just by, you know, taking the restriction away from the joints, taking pressure off of the nerves and allowing them to function properly. We were able to decompress his nervous system and allow it to do what it's meant to do, which is heal itself.
Wow. Did you guys hear that information? Man, I think I'm going to Activise Chiropractic and check it out. I think you should too. It will benefit you so much. Thank you, Dr. Zip, for your time. And thank you for allowing us to continue your practice and just gain information and be informed so that we can inform others.